So welcome back. This morning's second panel, when you're ready. This morning's second panel will focus on how a fellow can personally influence health policy. Again, I want to remind you that there are cards at the table that you can write down a question, just sort of flag it up, and a Jonas Scholar will pick it up and take it to the planning committee, who will then try to put the ones that are the same together and take them to the moderator and make sure that we have a diverse batch of questions. But at the end of the session, we'll also open up the microphones as we have in the past. So it's my pleasure now to introduce Planning Committee member Susan Apold, who will introduce the members of the plenary panel. Welcome, Susan.
Good morning. It is my pleasure to introduce this interactive plenary panel, Nursing Leadership and Health Policy. Our panel this morning is comprised of extraordinary nurses whose full credentials can be found on pages 19 and 20 of the program. So without further ado, I'd like to first introduce our moderator, Cheryl Sullivan, Chief Executive Officer of the American Academy of Nursing. Next, our panelists. First, Dr. Stephanie Ferguson, Director of the International Council of Nurses Leadership for Change Program and the ICN Burdett Global Nursing Leadership Institute in Geneva. Next, Dr. Marla Salmon, Professor of Nursing and Global Health at the University of Washington and Senior Visiting Fellow of Public Affairs. And finally, because wonderful things come in small packages, Dr. Julie Sochalski, Interim Associate Dean for Academic Programs and Co-Director of the National Clinical Scholars Program at the University of Pennsylvania. Welcome.
Welcome. Let's be seated.
Sit right down.
Well, good morning to all. We are going to jump right into a conversation. To transform health, we must drive policy, the name of the conference, and that implies leadership in health policy. I'm going to start with Stephanie Ferguson. So, she had an experience working in the White House as a White House fellow under President Clinton. You received the white envelope. In the return address, it has a picture of the blue White House that just says the White House. They don't use zip codes at the White House. What did you think you were going to accomplish? You're walking up to the portico of the White House. What did you think you were going to do? What were you going to accomplish?
Well,
what was your vision?
Well, here's the thing about vision. Don't let your ambition overtake your mission. And so for me, it was about the people of the United States of America and the populations of the world. When I applied to the White House Fellowship, you have to apply, and it's an application process, and you have to say to the White House, what will you be doing in 20 years from now? And so I said to them, in 20 years from now, I want to be leading global change in human resources for health and developing not only nurses in the world to be executive level leaders and ministers of health, prime ministers, et cetera, but also other health professionals so that we can really make a difference for the people of the world. So for me, it was all about, I'm here for the citizens of the United States of America. Yep. I'm here to serve my country. I am in it for the long haul. No matter what happens, whether it's disagreements with the Democrats, the Republicans, the Libertarians, the Independents, I am going to stay at the table until we build consensus.
Very good.
And so that's I didn't think about myself. I said, thank you, God, I have the opportunity to serve and to really be an advocate for women and children, because most people know that my passion as a clinician is women and children.
Fabulous opportunity.
Yeah.
How about you, Julie? You had a tremendous career before HRSA. Did you have the same ambition, same vision?
When you're in a policy role like that, you are in public service. And it is an awesome opportunity, a humbling opportunity to be able to be in a position to make a difference. And you take that very seriously every day. That I was there in each position that I was in, surrounded by incredibly strong, talented people, motivated to do the right thing.
There you go.
And make a difference in the public's health. And in the role I was most recently in at HRSA, it was through deploying nursing's resources, rich resources in the country, as effectively as possible so that we could move the needle on health. And through that, engage also globally in those conversations. But it is an amazing, life-changing opportunity to be in public service. And it was enjoyable work.
And not disappointing.
Not in the least. I go to bed exhausted every day and I always wish I had one more hour.
There you go. There you go. Marla, you are our distinguished IOM nurse scholar. Again, coming from 2 dean's positions, you had a tremendous career before walking into the IOM. What did you want to accomplish? What were your goals going to the IOM at that stage in your career, knowing that that was also going to be a launching point for the next career?
Yep.
What was your ambition?
Well, I
vision?
want to say first that I hope Stephanie runs for office.
Oh,
And
there you
soon.
go.
We'll work for her. Thanks for that.
Would you be a candidate? Yes. You know, the IOM Distinguished Nurse Scholar opportunity, which certainly was and is made possible by the Academy and the collaboration with AAN as well as the American Nurses Foundation, is a really unique opportunity. And I think that for me, it was the chance to actually take something that was a nagging concern, and this concern actually was, why is it that we don't invest in nursing and midwifery as a way to empower women, not only to deliver services, but to empower women? And what can we learn from countries around the world that are actually developing enterprise aimed at this goal? Well, this is a big question, and it years and years of working with women and nurses around the world and seeing the transformative power of nursing, it was nagging. And to actually have the possibility of being in a place where expertise is valued, where important questions are brought to bear, and where all of this aims at informing the public and policy was very special. And it came at a time when I didn't know how to proceed forward, and I needed to think about it, but I needed to think about it with people who understood the power of the Institute of Medicine. And its power, and the power of this phenomenal year that one can spend there, is that you can take questions and develop them in ways that produce insights that ultimately can inform policy. And that platform is unlike any other platform in the world. And it was a huge privilege for me. For me as a senior person in my career, it was also a wonderful transition point to say, how do I take the things I deeply care about and actually put them to work in another way, a different way than I've done before? But it is, excuse me, it is also a wonderful opportunity for others at different points in their careers, and I just can't encourage it enough.
Yeah, I just want to follow up on something that Stephanie said, because you're echoing it in your remarks there, is that one thing that I was left with is the importance, the incredible importance that there is, because it isn't about us. We need to make sure that we are bringing up an armada in that next generation who is ready to lead.
Yes.
And that each day we should be dedicating ourselves to make sure, because I see each day great ideas that are out there. And that's where we all started. So it's, can we in fact be ready to let go of some of that leadership, but use our experiences to guide that next generation, because so much needs to be done. And with these experiences, building leadership, building commitment, a verve for public service, public in the best way to be able to serve this nation.
Julie, what challenges, though, did you find in bringing policy forward? What strategies did you use to overcome it? And you came in with great ideas, and this is what I want to accomplish on behalf of the American people, the same as Stephanie. What were the challenges, though, in that surprised you, I guess?
When you have, your ideas always are going to confront others. They're going to confront timelines. They're going to confront processes. They're going to confront politics in a big way. And it's learning the pathways to navigate when you're looking at the how do you compromise, how do you get consensus. That's a whole different skill set to do. You also have to be willing to listen because your ideas are good ones, I'm sure, but others are equally tied to their ideas when you understand where they're coming from. But keeping your eye focused on what is the big policy objective here, and you learn there are lots of different pathways. And where you started may not be where you ended up, but the goal hasn't moved. So some of that challenge is trying to find those pathways, and you're learning them new each step along the way. The politics are everywhere. Yeah, they're a little amped up in some places a little more than others. You get kind of used to that. That's
Speaking of amping up, Stephanie, what about the White House?
Yeah.
Similar challenges?
Yeah. Well,
You
yes.
were there in 96, 97?
Yeah, it was 96, 97. So remember now, that was with Secretary Shalala. I was with her every second, every day, 18 hours a day, 24 hours, 7 days a week.
Oh, yeah.
And
That sounds
so,
familiar. Very familiar.
You need to learn how to manage your energy and not your time. And a lot of us, you know, what time is it? What time is it? And the issue is when you are running like that and you're doing, you have to really be on your A game. So with her.
Because it's very public.
Yeah.
Yeah, you don't want to be on the front page above the fold of the Washington Post, Stephanie.
So we were dealing with welfare reform, and we were dealing with the fact that it did not pass, and simultaneously dealing with health reform. Okay, so I'm with her, and she's like, Stephanie, we got to get this done. And so.
Just get it done, Stephanie.
And so I'm like, I'm going to go work the Hill.
And how'd that work out for you?
And we got it done. We got it done. I remember now, I was at the round table with our key stakeholders and colleagues to do SCHIP, which is State's Children's Health Insurance Program. I mean, basically, we made a war chest, and we said, listen, let's get 98% of everybody in the United States of America covered. VA, DOD, blah, 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 blah. Everybody will go for the child. If you can get the child healthy, you can get the mother healthy. Now, you got to be strategic. Didn't bring dad, partners, I don't care who, to the table. So we were very clever and strategic. We met every morning before this. We had staff meetings.
At what time were your staff meetings?
Well, first I had to get with the Secret Service to go pick up Madam Shalala. You know, I got the briefing pack. We're doing the brief. You know, get me right, Stephanie. Get me right. So I'm getting you right. And then I love the security team. You know, I'm always suspect with all of them. And so my thing is, you know, Stephanie, just so you know, if anybody tries to do anything bad to the secretary, you will be the first to die.
Well,
and I'm like, okay,
for
things
you.
are shaking. But
There's a challenge in health policy
so,
development.
But let me be very clear.
Indeed.
This is me. Oh, yeah. Game on. No, they're going to be the first to die. You watch yourself. But anyway, if anybody knows Secretary Shalala, and she is awesome, and she's a member of the American Academy of Nursing. But she takes no prisoners. You better be on your A game. She will hold you accountable. You better have read every outlet for the media and the news, the pros and the cons, what the Republicans are thinking, what the Latinos are thinking. I mean, everything. You better get in that car. You better be ready. A, B, C, and D. We're on this. Here's your schedule, blah, 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 blah. And this is her. Because, you know, because Secretary Shalala, I love, one time we had to go to Richmond and do something in the Commonwealth of Virginia. And so, you know, we're together for 12 hours. This is a no-talking mode, Stephanie, to make sure everybody knows, yes, ma'am. Now, when somebody tells me, just shut up, what do you do? 12 hours.
There you go. There you go.
So I was, you know, that's how my day started. So I lived in Virginia. I would get home at night at 11 p.m. at night. I would have to get up at 4:30 a.m. to get out of Virginia to come to my home here in Washington, D.C., get myself together. I'd have to get with the security team at 5 a.m. We're in the car, we're going to Georgetown, we're going to her house, we're getting
And that was every day?
And that's every day,
Yeah.
7 days a
There you
week,
go.
even on the planes, wherever. So that's why I say you have to manage your energy.
Marla, let me ask you something. Obviously, in your work with IOM, you had to work with a number of stakeholders, many stakeholder groups that were not in nursing. Tell me a little bit about who those stakeholders were, and just how did you confront or how did you approach policy development, working with stakeholders that you had not worked with before? And give us some examples of who those groups may have been. And what was the value of going through that process that you may not have known about before you worked with IOM?
Well, I think the starting point is that I realized early on in the work that I've been doing that the solutions to the problems don't belong to any one discipline. And that the efforts that have been made by any one discipline have generally not worked well. But those other disciplines that needed to be involved in terms of looking at women's empowerment, social enterprise, investment in developing nursing and midwifery enterprise, which is pretty arcane in our book, those other folks that do enterprise development didn't really see nursing as part of that, except relying on nurses to do the work of those enterprises. And so the development sector, on the other hand, saw women's enterprise as very important, but why would we do that in the health sector? And for crying out loud, what does that have to do with nursing? So it wasn't consensus development, it was common ground development, is the trying to find a place where everyone could see a stake, and also where together you could do something that benefited all of the sectors. And that took a lot of meeting, frankly. Took a lot of getting into places.
Are those meetings face-to-face versus conference call?
Face-to-face. And the other piece was bringing evidence along.
Yeah.
You know, so the ability to...
So are those binders or two-pagers?
Are those binders or two-pagers? They're usually 3 sentences to start. If the conversation doesn't happen after 3 sentences, you kind of have that polite, vacant look that you're looking at, and then you are gently say, someone comes in and says, it's time, sir, for your phone call. So, you know, and I think one of the critical pieces to that is finding a way in and finding someone who is credible and interested to pave the way. And being at the Institute of Medicine, there are a lot of people who are credible, interested, and open-minded about ideas. And so some of those discussions were paved by people who were in the Institute of Medicine who said, gee, I know someone over at State who's thinking about stuff about women's empowerment. But I do think it's that common ground development that's significant, and figuring out early on what do they care about and what benefit can you contribute to what they're trying to achieve. And you know, ultimately, the work ended up in the Bellagio IOM workshop.
Very exciting.
And the Institute of Medicine report that came out subsequently, and now the World Bank is taking up that work, and it's moving forward. But you know, there has to be a burning platform. There has to be a problem, and there have been many problems that this addresses, not the least of which is that you know, women are relied on in the health sector, about half of whom are unpaid. And we have the capacity to make a difference in that.
Her ability to be effective in that common ground was also sharing a common language. You've got to understand the language that others use, and that's what interdisciplinary gives you.
Oh, yeah, absolutely.
Because that creates that platform for getting things done. If you're locked in just one way of framing the problem, that person, you can't communicate with others other than people within your discipline. You've got to be able to do that, and that's where you can be effective. So that common language is such an important part in policy effectiveness.
Let me just add something to that, which is that, and this is a bit of a story. It won't be long though. When I was 3 sentences.
They got a clock.
Yeah, exactly. It says 43. It's an age clock, actually. When I was a nursing student, I went to see my dean because I decided I wanted to not be a nursing student only. I wanted to be a political science student. And she understood that knowing how to live in different worlds made a difference. And somehow she navigated it for me to study both. But I would just say the lesson out of that was policy matters, but knowing how to work the political system is really crucial.
Key.
Perfect, perfect. I was going to ask the question of what were those tools that you had in the toolbox when you left your assignment that you didn't have in there when you came in? And Julie, of course, talked about the language, the common language, and you talked about political process. Were there other tools, Julie, that were that you didn't bring to HRSA originally, but you found that you had them ways.
But I think that part of what we do as nurses, as critical thinkers in solving patient problems, I mean, that's exactly, you knew what needed to get done.
Yeah.
All of us are looking at that and saying, when you look at that entire enterprise of health and all those different people you have taken care of and all the different problems that are out there, there's not a one-form solution. But what you're doing is, like a good nurse, you assess the situation. And you're in there and you see what needs to be, but it's get it done. And understand those pathways. Our capacity to pivot is extraordinary. And now if you build that with understanding other disciplines, seeing where those problems are, what are the potential solutions, who you listen to be able to build those, you can be enormously effective. But we get it.
Yeah. And letting
what
them
about Stephanie? What about in your
just,
toolbox?
Really learning how to work with the media. I had worked with 4 governors. I was head of women's and children's programs of the Commonwealth of Virginia. Started the newborn screening program for sickle cell anemia and other hemoglobinopathies. I was used to using the media as my partner. And so, I would just say, going to the White House and being with Secretary Shalala takes you to the next level of learning how to work with the media. I mean, rule number 1, when you walk into the White House, remember this, Stephanie, whatever you do from this point on, you think twice, because it will be on the front page of the Washington Post. And it might make your career, or it will be the end of you.
or quite frankly, more importantly, other people's careers that you could take down very easily.
So learning also
unintended.
And learning the voice of your boss. Because you can't grandstand, and you are a staffer. You are that person's right-hand person. So you're doing things that you had other people maybe in your life doing for you. So the role is changing. But you better make sure you stay on point. So learning how to set this, the policy agenda and be strategic in your thinking and being able to negotiate and using the media to help you with that, So I had the best friends in the media. It's like, look, I do not want to be on CNN, but I just want to tell you. And we need your help. And these are the 3 key messages. And people are like, we're on it. And then, of course, my last point was, you better make us look good to feel that love.
There you go.
Yeah.
There you
so,
go. Or I won't call you again.
Yeah, because I won't call you again.
There you go. There you go. So. Yesterday, Sheila Burke, tremendous. We were so fortunate to have her come and speak at the leadership luncheon yesterday. She noted that nurse leaders have a level of expertise and leadership capability that some would say are sorely needed in health policy formation. You obviously had your own toolkit, but what did you place in your colleagues' toolkits at the IOM, at HRSA, and at the White House that you contributed to other people that they didn't even know were lacking before you had that assignment? Marla, do you want to start with that?
Yeah, there are 2 things. One is having the realization to start with that it's really important for others to carry the water. And it's your job to get the water to them. And so having briefings, small briefing papers, and I think 1 page usually does it as something to stick in someone's back pocket. And you were talking about the voice. Well, you tell that voice what to say in many ways. And I think giving people the words, giving people the initiative, a few salient facts, you should be able to put in an abstract, nothing more than a paragraph of what matters that they can verbalize, that they can communicate, and they can represent. And for them, letting them know how they benefit from it.
Very good.
That, I think, is the key, is that when you're building that, when you're looking at the toolkit, when you're trying to get something done, you absolutely can't get it done by yourself, but the way you create a groundswell is you're demonstrating to others what the benefit that they have, bringing in other partners, because it also gives you a multiplier. The kind of thing that you're trying to get done, in fact, could be going on in several places. Then you're creating a groundswell. Then it becomes background noise. Then it becomes what everybody's doing. And that's where the buy-in. So it is understanding who else can benefit from it. And you do that outreach, and that's why they do carry it for you. And there's trade-offs. You know, don't ever forget, there are trade-offs in all of those that are very important.
Reciprocity.
Absolutely. And they're going to, and probably one of the most important things is trust. Being candid. They're going to know it. But when you build that trust, they may not like the message, but they trust the person that it's coming from. And that's probably one of your most important tools that you have.
Reaching out first is really important in that, though. I mean, this reciprocity piece, I think sometimes...
Reaching out to whom?
It's when you're expecting or wanting someone else to carry the water. It's a lot easier to ask that when you've done something of value with or for that person. And so often, we sit there and wait for someone to help us. And there are lots of ways that if you have a common ground that you've developed, that even if someone's on the fringe, extending that connection to them in ways that benefits them, it builds a conversation. Otherwise, you come only asking, and only asking doesn't work.
It's got you have to have both.
That's true. So when I first went to my first day on the job with Secretary Shalala was a list of people that I had to go deliver, not the best message, which is you need to get yourself together because you're getting ready to be fired. And then I also had to go get money from the different agencies. But I
not fundraising. Let's be real clear.
Yeah, not fundraising. Not fundraising. Reallocation of funds.
Yeah.
And thank you for that. That's a nice way to put it, but it was fundraising, trust me.
I was trying to help you,
let me tell you
Stephanie.
why. Because White House fellows are we're nonpartisan, and we're political appointees that have the right to lobby and the right to intervene. And that's why I was such a very good person working on the Hill and asking for money, because I could get away with it. But what happened was I was there, you know, in the new term, and so there were new staff and old staff in the Democratic Party. Some needed to go, some needed to stay. So I said to her, can you give me 2 weeks to go work with these people so I can give them some new tools? Basically, I'm going to talk to them about your vision and mission and the president's. I'm going to come up with a strategic vision for you so that I can articulate it to them so that they can look at their divisions and say, here's how we're going to do this for you. And then we bring them all back around the table, Madam Secretary, and then they can come up front and do their presentations. And so she's like, excellent. I want it done immediately. So then, can you imagine? I won't tell you who all the 20 people were. You just imagine. And so here I am, White House. Hello, my name is Dr. Stephanie Ferguson. I'm the White House fellow with Secretary Shalala and President Clinton. And so I would like to meet with you. I have the following things to share with you. And I would go boom, boom, and boom. And let me tell you, everybody's like, can you come right now? Because they knew this is a serious phone call. And so I was very good with people. I went and I said, we can do this 2 ways. We can do it one-on-one, and then I'm going to make you look good. I'm going to help you do everything. You go tell your people, you make them feel good. Everything that's coming from you, you get in front of the secretary, everybody looks good. Or if you need me to be your facilitator, help you get this done, I can bring your home team together. We can stay all night, eat pizza, be happy, and then we'll get it done as a group. Well, they picked the latter. You know, Stephanie. No, come here, help me. And I had one wonderful person who was the head of a very big agency. Help me save my job. Talk to these people. And so anyway, that was a tough assignment. Now, think about this now. I'm 32 years old. Okay, I'm 52 now. I'm old.
We just did the math.
But I'm 32 years old, and here I am. And so it's back to what Sheila Burke, for some of you who came to the Institute for Nursing Leadership's luncheon, the Academy luncheon yesterday after our workshop, Sheila Burke, you know, talked about just what I tell people all the time. You don't know who is going to be that intern or that young person who's then going to be the CEO of Johnson & Johnson or something else in the world who's going to help you get to where you need to be and take it to the next level of the the term for the President of the United States. So we did it, and I only, you know, one person unfortunately bit the dust. It was unfortunate. But then, this is the kind of person I am. I said, okay, you're not gonna make it. Let's feel some love. But I'm gonna help you get a better job. And I think that's back, you know, you gotta, you know, I'm gonna help you get a better job.
Relationship building.
Yeah,
It's relationship building.
Yeah,
Yeah,
because I
truly.
think that's with that process, seeing where they are, you really have to learn how to thread the needle. You really got to learn how to thread the needle. So when I had the privilege of being a Robert Wood Johnson Health Policy Fellow and working in the office of then Senator Bill Bradley, real privilege, they were trying to do a lot of work on vaccine. So I'm in New Jersey, the state of every single pharmaceutical company, and I had Marion Wright Edelman on the phone every day screaming at me about the policies that, you know, the drug companies want. So I had Roy Vagelos in one ear and I had Marion Wright Edelman in the other ear, trying to figure out how to come up with a policy. At the end of the season, at the end of that calendar year, that congressional year, came up with a policy, and both Roy Vagelos and Marion Wright Edelman called the senator and said they were very happy with that. Yeah. And I got the highest compliment I've ever been paid in my life from the senator. He took a look at me and he said, "Don't ever run against me."
But I like what you just said about Marion Wright Edelman. As a very young person now, I'm coming out of Virginia, and I knew a lot of very politically strong people in the world. Very much a leader in my state, but I didn't know who was married to whom. And so, you know, Marion Wright Edelman is married to the senior counsel to Secretary Shalada Edelman. I mean, I'm with the man every day. And I loved him. And, you know, and then one day he said, "Stephanie, I don't think you know who my wife is." I'm like, "No, who is she?" Yeah. He's like, "Mary." I was like, "Thanks for sharing."
There you go. There you go. There you go.
The game on.
Yeah, there you go. Yesterday,
I like you more.
Yes.
I like you more.
Yesterday, Pat DeLeon said, being involved in policy development is a lifestyle, not a job.
That's right.
So for the new fellows who are out there and for folks who have never had those opportunities that those of us had who are on the panel today, when did that lifestyle get started? I mean, at what point, how did you know that you wanted to even apply to be a White House Fellow or the IOM Nurse Scholar after a tremendous career and getting involved with HRSA? So how'd you get involved in policy? I mean, Government 101 in college doesn't do justice to this. So,
well, my mother, if she was here, would say, I started when I was very young. I was the international president of the Brownies.
Did not know that.
For the world.
Did not know that.
Yes. So I started, you know, as a brownie. My mother tells the story. We were at the international meeting, and like, now we're looking for a president, and we'd like 3 candidates. And I raised my hand, and she's like, "Are you crazy?" And so I'm like, "Mom, this is good. I'm going to be the brownie. This is brownie for the brownies." And then I went all the way for, you know, my whole life as a Girl Scout. Okay, now one thing about the Girl Scouts, they are a leadership development program for young girls to really learn how to be political and policy developers and also survive in case somebody does try to kill you. But I started young, and then Governor Robb, which was married to Linda Robb, which is the daughter of President Johnson. When I was in high school, he chose me to be one of his, it's called Girl State. So you go and you learn how to be political and do policies. So I started very young. To the White House Fellowship, I was at the University of Virginia working on my doctorate. I was an ethnic minority research fellow. So I had very good people at AAN, Dr. Hattie Bissend and Carla Cheryl. I had a lot of good people in my life. That program gave me the opportunity, and I'm grateful to AAN and SAMHSA, to build my own research program, et cetera, and vulnerable populations and health systems, health policy, community psychology, multicultural education. It was just a fantastic opportunity at the University of Virginia. And so one of my doctoral students, UVA has a fabulous mentoring program for the doctoral program. So you get matched with somebody that's a policy person similar to you, psych, maternal child. And so one of my colleagues, she said to me, Stephanie, you're not going to do a traditional postdoc. And I had already told Samson that I like you all, but, you know, I'm not going to dice up the rat and see if the rat, you know, has cortisol, if the rat has 8 babies and lives in a housing development. Thanks for sharing. The rat is stressed, hungry, need a job. But I think I want to go do a policy fellowship like either RWJ, WKKL, blah, blah, blah. So she said, Stephanie, you should be a White House fellow. I've been doing research on this, and this is your next step. Great. And so that's what happened to me. It wasn't
so part of it was a mentor or somebody who...
Yes, yes.
Marla, how about you? I mean, you've long been involved in policy development. So think back of what was that trigger in your life?
Well, there were actually a couple. One was very early, but I do have to say that I think Speaker of the House is going to work better for you.
There you go.
No. Being the staff of the Speaker of the House.
You got it. Well, I think the first inclination I got that policy mattered in terms of what I cared about was when my mother insisted that we work in the fields when I was a kid. And the people that I got to know that I was amazed by were the migrant workers. And I was appalled by what they had to put up with, how they lived, and our expectations. And I thought it was so wrong. And it took me getting to my undergraduate program and Hal Osterud, public health officer for the state of Oregon, saying that policy is the single most important determinant of health. And that certainly led me into public health, but it also led me into that nagging piece of what's bigger than this that's making this happen? Why is this happening? And it was when Marie Henry called me when I was an assistant professor, associate professor at North Carolina in the School of Public Health. And she said, why don't you think about becoming director of the Division of Nursing? And I said, well, I'm a public health nurse. You know, I'm teaching public health nursing. And she said that being director of the Division of Nursing was a crucial way of practicing public health through the use of policy. And I still think policy is the single most important determinant of health, and I think that our capacity to be a part of it in whatever way possible. And I was executive branch, so I wasn't legislative branch. I wasn't out there. You know, I think the world is run by those who show up, and I think that political activism is crucial. But you can pass all the laws in the world, and if you don't implement those laws and those policies in a way that make a difference, there's not an ounce of hope that it will matter.
Absolutely. Julie.
10th grade Mr. Flazanis biology teacher took us to the first Earth Day.
Ooh.
Wow.
How cool is that?
Dates me. Add it up.
10th grade.
That's right. And we, that's when we met Ralph Nader.
Wow.
And I did environmental politics, and I've been a green queen ever since.
Yeah, that's excellent.
But it woke me up to the world that was bigger than I was, and I was passionate about it. And when I was a senior nursing student, my roommate convinced me to run for class president, which I did. And the dean of our School of Nursing at the University of Michigan was Carolyn Davis. And we worked together very closely. Then when I was a graduate student, and they decided to, in the middle of my master's program, I was actually finishing my master's program, they were going to rescind the entire Nurse Training Act.
Oh, yeah.
And my roommate, who was a first-year student, said, your entire traineeship is about to get flushed. I said, I'll go to the meeting. And the Kalishes at the University of Michigan arranged our nursing students to get on a bus and drive down to Washington and protest against the rescission of the Nurse Training Act. A Herculean feat that never should have happened. We called every nursing school in the entire country. Schools sent representatives from 23 states.
Wow. Wow.
Showed up we said, you know, come into the Capitol. We didn't have cell phones then. You know, we'll meet you in the Capitol Monday morning, 8 o'clock. They actually showed up. It was really incredible. people from all across the country, lobbied the Hill. I was in HHS, and we needed a national figure. Carolyn Davis had moved on from Dean. She was then the provost for our university.
That's right.
And I knocked on her door, and I said, would you lead our movement? And she said, if you tell me I need to be there. And I said, you do. We went down, and we got it revoked. And the money was put back in. And Phil Kaler said to me, now, Julie, I just want you to know, this never happens. I said, that's right, Phil, but it did. So I believe in the impossible.
I do too.
I think it can happen.
I do too.
You just
And
find,
isn't that another tool in each of your toolkits? It's not just about vision, it's that
you don't
power,
stop.
it's that, yeah.
You just, with the persistence
The
and
fire in
working,
the belly.
you just keep going, and you know it's going to happen. And great people did great things before we got on this stage, and
Yes.
that's why we're here.
Yes.
And we are standing on everybody's
There you
shoulders.
go.
Every one of you in the room, every one of you. And we can do great things together.
That's right.
And I think they're the champions that are out there. My dad's an optimist, and so am I. My mother's a realist and wish I'd calm down a little bit. I'm working on it. I keep telling
But you know,
Please don't.
when you talk about
Yeah.
the energy versus the time, I think that what keeps people truly engaged over time is that sense of purpose. And it's not purpose that is a one agenda. It's
Right.
about an issue.
It is that
you-
lifestyle.
Exactly.
Yeah.
it very much is.
Absolutely.
It's a lifestyle.
We would like to invite fellows to join us on the microphones too if you have any individual questions that we have not yet asked. But here's one. Oh, we do have somebody there. Okay. Hello.
Hi, that was quick. This is Sue Hassmiller, Robert Wood Johnson Foundation.
She made it to that microphone and
Yes, yes.
talk about energy.
So absolutely terrific conversation, and I think we all feel continually inspired. I have an additional call to action for everyone in this room, and that is to apply. Julie, you mentioned the Robert Wood Johnson Foundation Health Policy Fellows Program that you were part of. Such an important way to get on the Hill and practice those policy wares. And Marla and Stephanie talked about the importance of being able to talk other people's language, right? It's how you get your work done with other sectors. So I would encourage everyone in this room to really think about applying for the Robert Wood Johnson Foundation Health Policy Fellows Program. That program will go on. We understand that our nursing and physician and all of the unidisciplinary programs are being sunset, but that program is going on because it is interprofessional. It gets you up to the Hill for a year and to do some of the incredible things that these ladies have talked about. And I will tell you a dark little dirty secret. Nurses are not applying for this program. Why? They're not applying for this program, and we need more nurses to do that. In addition, we have some tremendous leadership development programs that are going to be announced in this coming year. The new Clinical Scholars Program, Multi-Sector Leaders Program, Diversity in Health Policy. So we have some great programs that will allow you to work with other sectors, to learn other people's language, to do what these ladies are doing. But you know what? We can't do it if you don't apply. So I really personally am asking you, it's a personal mission for me. So please do. And come and see me, email me for help. Anything you need, I am here for you, but just do it.
Yeah. I would just like to say, we are in the process now for recruiting. Every time, October to February is the recruitment cycle for the White House Fellows Program. I was a fellow 96, 97, and it's only 6 of us. 1 of us, we've already died. And the issue is we have not had a nurse since I was the last one. And I have people in this audience that have helped me to coach and mentor people, but I've also had some people in this audience that have said to people not to apply for the White House Fellow until you get tenure. Now, don't be stupid, okay? we look for you at age 25 to 33. And so the issue is this, you got plenty of time to become tenured.
There you go.
Does that make sense?
There you go.
So
Yes.
if you're interested, you need to talk to me. I'm on the selection committee. I do the first cut. I've been doing the first cut since 1997. And so when I have somebody that I work with, I reach out to people and I take myself out of the first cut. Let me be clear, when I say to the people, I'm walking out of the room because I have a conflict of interest here, the people end up being selected.
They know what the conflict is. One, we have,
That's good. That's good.
I agree with Sue. Apply.
so one of the questions from the audience earlier said, the panelists are so accomplished and inspiring, but where does someone like me start? You now have 2 very concrete suggestions.
Yeah. Yeah. Can I say one more thing they should start? You need to be very active with the American Nurses Association. Listen, I started out in the state of Virginia, at the Virginia Nurses Association, but I started even way before that as a member and a very active recruiter for the National Student Nurses Association. And so you know, paying money to the PAC and being active. So remember now, you got to be with the AAN if you want to get appointed. What's going to happen when the people call and say, do you know Doohickey? And they're like, well, no, we don't know her. I'll tell you what they're going to say, thanks for sharing.
There you go.
I would tack on to
yes,
that, though,
Marla.
that find another organization that isn't a nursing organization and be active in that way.
Yes.
Your communities are loaded.
Yeah.
There's
But you have to
plenty.
have your nursing
No
people.
question.
There you
Yeah.
go.
No question.
There you go. Question over here on the left.
Hi, I'm Lauren Harden from Trinity Health. First of all, thank you for a very inspiring presentation and also all the service you've dedicated to bring the voice forward. As a clinician, I'm very familiar with navigating complex situations, so I know the culture and dynamics of, I know how to deal with somebody who threatened to blow up the ER, or 5 fighting neurosurgeons. I totally get that. But the bigger...
It's similar, really.
No problem, I can do that.
You can work on the hill.
Yeah.
Yes. Who do you want to go work with?
No
Good
problem.
skills.
But what's been fascinating to me is the financial success of my work has grown. I've ended up in rooms at much different cultural contexts and ways of navigating power. And so I'm fascinated with knowing, how did you learn how to hold the discipline of nursing and that value and still bridge different values and culture? I asked a couple of my physician colleagues in this field, what did you read, or what should I read? And they said, read The Art of War.
Oh, yes.
So I was curious how you would answer that.
Well, there's undoubtedly things you can read. The most important thing you can have is your kitchen cabinet.
Yes.
You need a group that you can trust, who have been there and are giving you advice in different ways. So, you know, I always, in each position, I always have my girlfriends, you know, and they were the ones that were there that I could tap when I had to roll something out. I said, okay, who's going to chop off my head? Looking at that situation, how do I navigate this? You know, how do I thread that needle? How do I get myself out there? If you don't have a support group, you got a whole room full. I mean, that's what you're going to look at. You're going to look at those people that are, and then you do the same. You're there. That's part of it, is you have to be there and be available for others. They're going to call you and say, you know, 15 minutes, can you tell me, you know, Stephanie's going to call me, I'm going to answer. Yeah, because we're all part of that same hood.
I think it's...
Stephen, let me make one comment. Stephen Covey, say you remember Stephen Covey. Management is efficiency in climbing the ladder of success, but leadership determines whether the ladder is leaning against the right wall.
That's right.
And I think what Julie has just outlined is absolutely correct, that it's really that kitchen cabinet,
Yes.
the honest brokers around you who can let you know if you're even close to the wall, let alone leaning against the right one.
Yes.
Marla.
I think the other piece to that is add to your cabinet some ingredients you haven't cooked with before, because it's really important to understand what you're trying to get into and to be knowledgeable enough to ask questions that allow you to get advice. And I think that so often, and I do think this is some of the challenge of getting nurses on boards, we work so hard to get us in,
Right.
And then that individual may not know what they can contribute, and then on the other hand, others certainly won't know without that person reaching out and understanding what those other people do.
Yeah.
And also how to help the person just behind you to
Yes,
pull them
yes.
along too, so it's not just that
Gotcha.
one off. Absolutely. There we have a question over here on the right.
Hi, Kay Ball from Otterbein University in Westerville, Ohio. In 1994, I was very privileged as vice chair of NOLF to be invited to work at the White House to help represent nurses in specialty practice to help with Hillary's attempt of healthcare reform. And that was very aspiring. Now I teach policy at the bachelor's, master's, and doctoral level at Otterbein, and my question is, how do you handle nurses who are just complacent? You know, that's not part of my role as a nurse to get involved with politics, or nurses who are blatantly going against what organized nursing has made a stance on. And I know education is key, but is there anything else we can do to try to help round these nurses and bring them into the organized nursing viewpoint or stance?
Stephanie.
Well, here's the thing. Now stop worrying about herding those cats. Okay? Really. You need to let them know that you know that they are not at the table. They're actually on the menu, and some of them have been digested. Clearly, they're not going to be in your kitchen cabinet unless you want your enemy at your footstool. Now, let me tell you one thing I learned being at the White House. There are permanent friends and permanent enemies. You know how some people in the old days in nursing, there are no permanent friends or permanent enemies.
Oh, yeah.
Oh, yes, it is. Oh, yes, it is.
Oh, yeah.
But you got to be able to navigate that and have crucial conversations with people and deal with conflict resolution. But don't spend your time dealing with negative people that are just simple. Do not spend any time. Once you start bringing people, when people whisper in your ear, Stephanie, bring me to the table, bring me to the table, bring me to the table. Then the other people are sitting in the corner, I didn't get it to come to the table. I bet they change themselves.
Okay.
And if they don't worry. Now, let me talk about academia, because the Lord knows I'm one of you. We don't need another theory course. You hear me? We do not need another theory course in health policy. Oh my God, I see all these people. This is the book on health policy. What you need is to do what Sue is saying and apply to these things and go and get your students so they are on the hill, they practice policy, they practice leading. Does that make sense?
That makes sense, and I do that with each of the classes. I
Yes, you
require
have
them to go to a legislative or regulatory venue that they're not comfortable with. I have had nurses say and send me emails, you have changed my life.
It's
because
about the
making me do that."
transformation.
There you go.
It's
Yeah.
about the transformation, so don't worry about the people.
We have talked a number of times, people have said, just do it, just
Yeah,
jump
just
in,
do
just
it.
do it. In looking at the Academy, American Academy of Nursing as an organization, what is it that you think that we should be just doing it? What is the Academy should be doing in the relationship building, in the policy development that we're not doing right now? Marla.
So, you know, I think, and I'm responding as well to the question that was just asked, I think that we can often have an agenda that isn't well informed, and we can bring a lot of people to the table saying really stupid things at times because we locked in. And the Academy has the ability to unlock the way that we think and to create actually platforms that are informed by evidence, that are proposing solutions that actually can work. And you know, I remember the first time I was trying to think of a professional organization that had had an impact on the public's health. It was the American Academy of Pediatrics. Think of the numbers of times, whether it was in terms of SIDS or immunizations or whatever, they come out with a simple platform that's evidence-based, and we do and can too. But that means not a million people working on one issue. It means groups of people working on some issues coming up with solutions that are informed by, in fact, evidence, and then push it forward.
How about timeliness?
Timeliness?
Being nimble.
If you show up and it's not there, it doesn't matter.
There you go.
Yeah.
There you go.
But I think it's also, you're looking at what's on that agenda, so I couldn't agree more.
Yeah.
But, you know, are you a part of the conversation?
Yeah.
You know, how can the academy help that voice of nursing become a part of the conversation? And I don't mean just about the nursing profession, which is when you go up to the Hill, that's what they're expecting out of you. They just think that you're going to be there advocating for nursing. You know,
But it's not about us. We started this conversation about how do we impact policy.
It's about what are you bringing, what evidence do you bring to bear to move the needle, and why that becomes important. We have plenty of examples, and we have great policy examples of things that have done. I've spoken with Diana about the work that the Edge Runners have done.
Yeah,
I
absolutely.
mean, that's right in the lane of patient engagement. That's right in the lane of so many things that have been talked about in the Affordable Care Act before it and since then. And those are things that are making a difference in people's lives. And that is one place that the Academy, I think, can really help, is to stimulate those conversations, but look for that agenda building, which is, we are an important voice in improving the health of the public.
Absolutely. Question right over here on the right.
Brenda Cleary from North Carolina, an awesome panel. I have just a comment in 3 words. Run, Stephanie, run.
No.
There you go. Over here on the left.
Hi, Nancy Valentine, UIC College of Nursing. I know each of you, you're each spectacular, and this has been a very exciting forum. I want to thank you very much for putting this together, and I have 2 comments. One is an unpaid, believe me, this was not a plant, but for those of you who are interested in a policy manual, I just noticed that my colleague from Pennsylvania, Marguerite Zalon, and her colleagues have written a book, From Bedside to Boardroom. It's all policy examples, and I'm going to buy it. I hope everybody else thinks about it as well. And I don't get, that's an unpaid announcement. But the other thing I was thinking about, and this is really dovetailing on how can we leverage the talent for those of you, and myself included, have been in very key policy roles. How can we really spend more time together? Because one of the problems, as we've heard in this discussion, and I've experienced myself, is that when you're in these roles, it is all consuming. So it's not really possible to network and have these kind of discussions like we're having here. And I wonder if there's a possibility that the Academy could have some kind of a policy think tank as a follow-up to this, where those of us who have made contributions that really want to take some of the policy work of the Academy and leverage it to another level and think about how that could be done. In addition to the work that the policy work that's done in each of the expert panels, I have experienced in my expert panel work, and I think that this has to be shared across the board, there is not a lot of oomph to take it to that next policy level, because it isn't like organized in a way that I feel, this is my opinion, that it really could be as impactful. There are ways that we could potentially make this, speed it up, get it clear, make an impact. Get it done, as Stephanie said. Like, let's pretend we're Donna Shalala. So how can we get it done more effectively in the Academy? And I know Stephanie's got some ideas. Thank you.
Well, first of all, we want you to be a member of the Institute of Nursing Leadership. Now, that INL, Angela McBride is in the house. She's the chair, and I'm the co-chair, and a lot of us are members. And we need you because we want to get you on boards. But remember, getting on the board, that's policy 101.293, which is governance, policy, leadership. So right now, many of you, when you are on the journey of leadership, start with yourself, do your self-assessment. Many people came to our workshop yesterday. They did just that. But we were also very clear with people, you're at different stages now. As Angela, I loved it. She said you're bimodal. And so you're all researchers. I don't have to define that for you. But
and there is no medication.
And there's no medication for that. No. But what this means is you need to begin the process of reframing yourself. Okay? We are the Academy.
And talk to your kitchen cabinet while you're
reframing. Talk to your kitchen cabinet. We are the Academy. You are in the Academy because you are leaders who are policy oriented. Okay, so you're in the Academy for that, so you need to make that. Now, let me just talk about the expert panels a little bit.
Very briefly.
And people,
briefly.
You are the members, so you fix your panel.
There you go. Yeah. The question over here, we have
Hi,
Time
Judy
for
Haber.
probably one question.
Judy Haber from NYU, and mine is a comment and a thank you for the policy support that are important, so important to those of us who are working on policy interprofessionally and at the grassroots level. I work on oral health and increasing oral health for all, and it has been a tenacity experience, but a wonderful experience, and if it was not for people like Julie at HRSA, supporting grants that make the work, the incubator work possible, culminating in the endorsement of white papers, policy white papers by the Academy that carry this conversation further, that enables us to advance these important issues and to have a strong voice that has not been recognized before by our colleagues in other disciplines. So I want to thank you, and this was a fabulous presentation, and looking forward to taking the next steps.
Yeah. Do we have time for one other quick question?
I just want to make a comment on what Judy had said, is what you're really talking about here is there's a lot of energy and talent that has not been tapped. So if you're looking at, Academy 2.0, what would that look like? And what would you want, what would its parts be? Because policy is being made while we are sitting here in this room.
That's right.
If we are not in the room, our voice is not there.
That's right.
So it's made every single day. So, in the words of Master Yoda, do or do not. There is no try.
Hi, my name is Brenda Oldham, and I'm from the state of Michigan, and I'm just delighted to be here, and this is a great panel. I'm in the financial industry, but what you are speaking about is very important to our industry as well. And one of the things that I was just looking at what you've been doing, Julie, is involved in expanding affordable health in undeserved communities, something that we really need. I'm wondering, what impact has the board had in the Affordable Health Care Act? Have they been involved in that in any kind of way?
Would you?
Diana
just happens to walk up just.
Yeah, timing is everything.
So we were asked by CMS to provide a nursing interpretation of implementation of the Affordable Care Act. Yeah. And I want to acknowledge David Keaton, who's a board member who worked very hard on that. We went to other nursing organizations, said if you would like to sign on or give us your input as well. So we looked to try to get other perspectives into that. But we shared that, and it is posted on the Academy website. I also want to say that we have been continuing to try to get in the room, and we are getting in the room. We've met with people like Patrick Conway, head of CMMI, the Centers for Medicare Medicaid Innovation. We have talked with him about the Edge Runner work, about our interest in accelerating movement on global payments, some of what you're hearing here today. We've met with the national governors. Mary Wakefield. We just met, the board met with her the other day and some of her staff.
The entire board.
We've met with the National Governors Association, and we tell them that we have experts in the Academy, in their states, at the national level, and that we are here to provide expertise and perspectives on the important issues of our day. I also want to point out that the board has worked very hard to look at how do we ramp up the work of the expert panels. And come to the business meeting, because at the business meeting in the packet, you will see the documents, the policy briefs, position statements, et cetera, a list of them that have been generated over the last year or 2 years. Go to the Academy website. They're on the website. I encourage you to use them. We also are looking to ramp up that dissemination effort. It has to be ramped up. And so you will be seeing that happening and unfolding over the coming year, but we've also started to ramp it up this year. So we're moving in that direction. I would encourage you to keep sharing your ideas with the board about how to do that, as well as with Cheryl Sullivan, our CEO. So we're right along with you. Please keep pushing us and help us along the way.
I'd like to thank the panel. Thank you so much for joining us. And we will exit.
Oh, wait a minute, before you leave. So I'm incredibly proud of these fellows, and I want to also say that Stephanie Ferguson is about to be honored by the White House Policy Program. They are, yes.
Thank you.
She is recognized in that program as a leader within the program, as a leading alumna of that program. So thank you, Stephanie.
Yeah, it's the 50th anniversary. So President Obama and the commissioners chose me, one of three of us, for the three of the most powerful fellows, post Colin Powell, Wesley Clark, you know, their generation, the original generation. So the Johnson family is coming to be with me because remember, Linda Johnson, her dad started it, and we're very good friends, so.
Good.
Congratulations.
Congratulations. And thank you all for an excellent panel. Thank you, yes. So I also just want to reiterate that you have three, some of you don't have three, some of you only have 2 opportunities. We're too old for one of them. So if you're not older than 33, or if you know of a young nurse who would be a great candidate for this, the White House Policy Program, talk to Stephanie. She will coach, she will help. We need to get nurses applying. You've heard about the Robert Wood Johnson Health Policy Fellowship that is for mid-career people, not early career, mid-career, not for those of us who are old. As well as the IOM Nurse Scholar in Residency program that Marla was a part of. That work that she's doing on and that she's continuing, that she's working on and continuing, arose from that residency. And Julie Fairman on the board can talk with you about her experience. Suzanne Bakken you heard from earlier. So do go to the Academy website and look for how to apply for that. We also know that many of you who are academics might be interested in doing something like that on a sabbatical. So we've moved the application time up so that you can apply and help to plan for that. So I want to encourage you to take advantage of these opportunities for developing your own policy skills and knowledge. So now I have the great privilege of presenting this year's Nurse Leader in Aging Award. In 2006, the Academy, in partnership with the John A. Hartford Foundation, recognized the importance of calling attention to the specialized field of gerontological nursing. There is no group, although Ann Turner Hansen may disagree with this, there is no group of patients who depend more on nurses to meet their health and healthcare needs than our elder population. She would argue children. The criteria for the Nurse Leader in Aging Award is intentionally defined broadly, encompassing the full spectrum of gerontological nursing, including healthcare, research, education, policy, and public service. The recipient must demonstrate superlative work that advances new areas of knowledge and changes how a problem in aging is understood. This year's selection committee included Ruth Kleinpel, Amy Cotton, Tara Cortez, Deborah Toney, and Jean Wyman, and I want to thank them for their service on this committee. They had a, yes. They actually had a very tough job because the quality of work being conducted in gerontological nursing is evidenced by this year's 7 outstanding nominees, any one of whom could have received this award and the Academy would have been proud to give it to them. So with such outstanding and qualified colleagues, there can be no doubt that this year's award winner is an exemplar in the field. This year's Nurse Leader in Aging Award recipient is Dr. Barbara J. Bowers. Barbara, come on up. So Dr. Bowers' accomplishments encompass the full range of gerontological nursing, including research, education, practice, and policy. She's highly regarded in the United States and around the world. Barbara has had over 30 funded projects from a wide range of domestic and international, as well as public and private funding sources. She's widely respected for her research on frail older adults living in long-term care settings, most recently participating in the National Collaborative Study of the Greenhouse Initiative. And if you don't know about that, it's where you're going to want to be. Talk to her. From her work with state and federal agencies in the mid-1990s to her pioneering the Wisconsin Partnership Program to her more recent Commonwealth Fund project on consistent assignment of nursing home staff, Dr. Bauer's work has had an enormous impact on improving the quality of life and the quality of care of older individuals, and has in fact shaped the national agenda of advancing excellence in America's nursing homes. The same care and attention Barbara provides to older adults is equally provided to those whom she teaches and mentors. In the last 10 years, she has mentored 7 Hartford Scholars and 4 NIH NRSA recipients. And, yes, and recognizing the importance of interdisciplinary collaboration to the well-being of the elderly, Dr. Bowers has also taught 17 semesters of an interdisciplinary legal medical model to address elders' legal needs course. Dr. Bauer's accomplishments and contributions are far too extensive for me to recite, yet despite her years of commitment and unsurpassed work, she is, as one of her colleagues and fellow nominees for this award stated, a humble and deliberate scholar, an advocate who avoids the limelight for the sake of self-promotion. Well, on behalf of the American Academy of Nursing, and the John A. Hartford Foundation, I am all too happy to shine a very bright spotlight on Dr. Barbara Bowers today as she receives the 2015 Nurse Leader in Aging Award.
Thank you.
Come over here with me.
Whoops. So much for avoiding the limelight. I just have a few comments to make. First of all, none of the things that were mentioned were things that I did by myself. I think actually that's one of the wonderful things about the Academy, but my entire career I've been blessed with the ability to work with other people who are committed, passionate, and just very talented. We're all familiar with the population aging. I can't imagine there's a person in the room who hasn't heard about the huge increase in longevity and the number of people who are living to an old age in this country and around the world. You're probably all much more familiar with the dire predictions about what that means for all of us than with some of the good things. So I don't think there's a day that I don't open a newspaper or a magazine or listen to the news and hear something about the disaster or the catastrophe that's coming because of this aging gray tsunami. Nurses have been really at the forefront of identifying well-being, the potential that we can achieve by those extra years, but also extra high-quality years, good health, good engagement in the community, and a meaningful life. I think one of the things that probably bothers me the most is the fact that while some of us enjoy those extra years that are good quality, there are many people who still don't. The inequities and the disparities are huge, nationally and internationally. I mean, if you look at what's going on in our country as well as many other countries, clearly some people are left out of this. I was inspired by the talk this morning about precision medicine and big data. The potential that those innovations can actually do something about this. I have a student who was born in a refugee camp in Thailand. Part of the Hmong community, came to the U.S. when she wasn't very old, and is really concerned about the aging Hmong community. And one of the things she's discovered is there is no data. Hmong are clumped in, aggregated with Asian Americans, and as you may or may not know, some Asian American subgroups enjoy very good health outcomes and some very poor. But because the Hmong are not distinguished, they've become invisible. So I was actually, as I I heard those comments, I was thinking about what potential there may be there for helping. So I think one of our biggest challenges is to figure out how we share these good possible potential benefits with everybody. So how do we do that? We need caring, compassionate, skilled, courageous practitioners, innovative, agile organizations, and absolutely, like we heard in this panel today, public policies that support doing these things and that help distribute the benefits a lot more equitably. I want to thank the Academy. I think this has been an amazing opportunity for the last several years. I can't remember how long I've been a fellow here, but being part of the expert panel on aging, any one of whom could be standing here, I think I would accept this for the group. Amazing group of people, and it's incredible what you can do when you bring together a group of people like that who collectively represent an amazing breadth and depth of knowledge. I do want to also really acknowledge the Hartford Foundation and the Hartford Center for Gerontological Nursing Excellence. They have done an amazing job of building a cadre, well, not a cadre, actually a generation of outstanding nurse scholars. And as I look through what they're doing, they're talented, they're skilled, they have fire in the belly, and it makes me think when I have a few friends, I'm part of the group that's starting to trickle out and retire. And some people look back and say, gee, what's going to happen when we're gone? I'm kind of worried about what's going on. I have to say, looking at this generation of scholars that have really been nurtured by Hartford funding, I am not worried. We're in really good hands. We just need to get more of them in the Academy. So thank you.
And I, too, want to acknowledge and thank the John A. Hartford Foundation. As many of you know, we had a grant here for a number of years for the building academic capacity in geriatric nursing education, and it was a fabulous program. It's moved over. Taylor Harden is heading up the next generation of that at GSA, the Gerontological Society of America. We're working together on a study that Adriana Perez is leading on looking at the scholars and fellows who have come out of that program and what are they doing around policy. And so we're in the midst of completing that work. So we're appreciative of the expertise that you bring to bear and all of our geriatric nursing colleagues. So I want to thank the panelists this morning, our guests and fellows for an excellent morning. I hope you enjoy lunch in the company of colleagues and friends. We look forward to this afternoon's first session of Policy Dialogues, which will begin promptly at 1:15. Then, after a healthy break, the second session of Policy Dialogues takes place at 3 o'clock. We have 2 concurrent dialogues in the first session and 3 in the second session. Please look at your program to figure out which policy dialogue you'd like to attend. I want to give a special thanks to Hill Rom for their continued sponsorship of these policy dialogues. And the interim healthy break. It really has enabled us to ramp up our conversation about the directions that the Academy needs to go. So they are an integral part of this policy conference and are specifically designed to provide fellows with the opportunity to come together as a focus group, to share insights and expertise in order to propel the Academy's work of transforming health and care delivery forward. The board, expert panel co-chairs, and I are looking forward to your constructive ideas and engagement to move the Academy's mission forward. Later this afternoon, we will all return to this ballroom for the Academy and Fellow Selection Open Forum, where you can share your thoughts and comments with the board and learn more on the application and review process from the co-chairs for the Fellow Selection Committee. So thank you and enjoy this afternoon.